amount I can tell from looking at somebody's tongue about their digestive system is a lot. If somebody has ridges on the side of their tongue, in Chinese medicine, that's actually called a spleen qi deficiency, but really that means your digestive system is weak. So there are specific herbs and foods and supplements that actually build up and strengthen the gut.
Why does that work? Do they know why it works?
It's the very same reason how you found out that the Lion Diet works for you. Imagine thousands of physicians for 1,000 years, testing and trying and paying close attention to patients and working with them, doing millions of individual case studies. They started noticing these patterns between, oh, sour activates the liver. Oh, bitter activates bile release. I think there's a lot of people that they're just so busy that their body can't heal. Most of the time it's like cell phone buzzy, an email reading, artificial light, and then to be able to get out in nature and then connect with God and spend time in gratitude and awe and wonder. It's incredibly healing.
Dr. Josh Axe, welcome to my podcast.
Mikhaila, thanks for having me on.
Thanks for coming all the way here. And thank you for the last couple of years when I got really sick from mold, we connected. You put me in touch with some people who were very helpful. So I appreciate the support because I was feeling very bad then, and that was very helpful.
I'm a big fan of the Peterson and Fuller family, so want to support you guys any way I can. So yeah.
Well, thank you for that. Before we get started, can you give a brief background about who you are and what it is you do?
Yep. Dr. Josh Axe. I am a doctor of functional medicine, doctor of chiropractic, and a certified nutritionist. And big focus for a lot of years for me has been helping people heal a lot of times unhealable conditions. And this really started for me when I had my mom who was diagnosed with cancer, and she went through all the conventional treatments. And then later on, we went through all natural treatments. And seeing my mom healed from cancer using just food and natural lifestyle medicine really inspired me to become a doctor and want to help people heal using food and herbs and supplements and lifestyle medicine. And so now I run a virtual medical clinic. It's called the Health Institute, where we help people, heal autoimmune disease and hypothyroidism and infertility and a number of conditions. And I'm co-founder of Ancient Nutrition, a supplement company. And
Great.
Yeah.
The only doctors that I automatically have some trust for are functional doctors. They're hard to find. I tried to find one when I was in Toronto in 2015. I was like, what is this functional medicine thing? What does that mean? So we can get into that. And I could only find one or two doctors, and they were booked, completely solid, couldn't take any patients. So what's the difference between a doctor you would normally see and a functional doctor?
Let me go kind of 3 levels deep to kind of answer this. I would say there is a difference between when you look at conventional medical doctor, more integrative, and then maybe one that's more functional medicine, but really looking at the root cause, really diving deep into that. So what will happen, I'll give you an example with a condition like autoimmune disease. Let's use Hashimoto's thyroiditis. If a patient goes in to see a conventional medical doctor with that, what they're going to do is they're going to prescribe a drug like Synthroid. Boom, you're done. That's it. That's all they know how to do. Or maybe an immunosuppressant, but something like that. And then you've got more of the integrative or even the nutritionist, and they're going to probably say, hey, there's one diet for everybody. Let's go paleo, let's go keto, let's go vegan. Surprisingly, there's still people recommending that. It shouldn't be, but let's do that. And then here's magnesium and omega-3s and a few things. Okay, and that's kind of the depth. And that will help a number of people. But it's really still not getting to the root of why do you have this issue in the first place versus if you go to a doctor that's really one of the top, 10 to 20% of functional medicine doctors out there today, they're going to run lab work. They're going to look at your symptoms. They're going to look at everything they possibly can to say, okay, why do you have autoimmune disease? Why do you have Hashimoto's thyroiditis? Okay, well, we did an oat panel or organic acids and micronutrients. You're incredibly depleted in vitamin D. You're incredibly depleted in L-glutamine, you're depleted in all these nutrients. Okay, let's run an IgG panel. Let's run, let's do a stool test and see what's going on in your gut microbiome. Okay, we've accumulated all this information now and we see what's going on. And so now what we're going to do is treat the root of your issue. And oftentimes with an issue like Hashimoto's, it's starting in your gut and your adrenals. So we need to go and fix those using, diet, using certain herbals, using certain vitamins and nutritional compounds, and then holistic treatments, everything from hyperbaric chamber to ozone therapy to IVs to, you name it. And so really, I think functional medicine doctors are really intent on focusing on healing the root cause, typically with natural means. And some of them that are more integrative, maybe they use a medication here and there on occasion, but for the most part, it's very focused on healing an issue naturally.
Okay.
But integrative, when most integrative practitioners, they are prescribing medications and they're doing things holistically and they're recommending supplements. So they're kind of living in both worlds typically.
That's what I've seen, I think. I've worked with some integrative doctors too, and that's what it looks like. Okay, interesting. Let me see. Where do I want to start? Well, I guess you mentioned an oat panel. So that's organic acids.
Yeah.
Why would somebody do that test?
Yeah, and this goes into, when you look at traditional blood work today, a lot of the things they're running are absolutely useless, or at least not looking for what we should look for in somebody with inflammatory disease, autoimmune disease, or other conditions a lot of people are struggling with today, like long COVID and Lyme disease and all these conditions. And so if you go and check somebody's cholesterol level, it's not that helpful, versus an organic acids test is really looking at what are you deficient in? Not what are your symptoms, or what are your blood markers showing in terms of, again, high cholesterol, and they are going to get into some things like maybe a hormone panel, or if your creatine is high, or those sort of things. So they're looking at basically the function of your kidneys and your arteries and a number of things. That's what most medical tests are doing today. What I think an organic acids test or a micronutrient test or an oat test does, you're going one layer closer to the root cause of saying, okay, well, these nutritional deficiencies, many of them are actually going to cause some of these issues that are more downstream. And so start to fix more of those issues. But it's really looking at saying, because here's an example. If somebody has very low levels of magnesium or vitamin D or certain B vitamins, well, your body isn't going to be, your mitochondria aren't going to be working as well. Your body's not going to be creating enough cellular energy. Certain conversions that should be happening in the body won't be happening. And that's going to predispose somebody to disease, even like depression. If somebody's low in omega-3s or vitamin D or magnesium or vitamin B6 or B9 or B12 or B2, there's a lot of things that can really push somebody even further into depression if they're deficient in one of those nutrients.
If you guys aren't on Peterson Academy, you're missing out. There are over 25 8-hour courses on there from people like Vervaeke, Michael Malice, Keith Campbell. My dad has 3 8-hour courses out now, including Nietzsche, Sermon on the Mount, and Intro to Personality, which is excellent. Brian Keating's on there. David Eagleman on brain plasticity just came out, which I love. Go to petersonacademy.com and come in and see what it's like. We have a 7-day money-back guarantee, so you can poke around the website, look at the courses, and get a refund if you want, no strings attached. Any age is welcome. The courses are university level. Thanks, guys. Enjoy the rest of the podcast. We were talking a bit about this before we started the podcast, but I've had low folate for years. Yeah. I've never had symptoms that I've noticed of low folate, but whenever I've been pregnant, I've been like, I'm going to take folate. I usually do it by injection just in case, because I'm only eating meat. This diet's very new. I was like, I don't want to be the person that ends up folate deficient during pregnancy severely, that impacts the baby or something stupid like that. Why do you think that could potentially be caused by just not eating folate-rich sources? Or for me, I know this is a guess, do you think that could be an absorption issue?
Well, so one example of this would be looking at the methylfolate cycle. Okay. Yeah. And so a lot of us have heard of this MTHFR gene variant where you can have one of or two of the variations that makes it harder for your body to convert folate into what your body can use, which is called methylfolate. And there are several things, if you look at this cycle, to where, for your body, if you're going to eat, let's say, take a folic acid supplement. Okay. Your body needs vitamin B2, and then it needs B6, and then it needs B12 in order to convert it into methylfolate. So think about when you take folic acid, it's like you're getting a car without wheels on it. You can't drive it, you can't use it. What your body tends to do, if it's really healthy and functioning well, is it'll go and put wheels on the car. So now your body, it can drive things places, it can operate, it can function properly. But if you're deficient, and again, B2, B6 or B12, your body isn't going to convert things properly. And then there's all kinds of other things if you're deficient in, like zinc and magnesium and choline, that'll affect the conversion as well. So what a lot of people don't realize, now some people could take folic acid, now this is rare and it fixes the problem. Some people can take methylfolate and that fixes the problem. But for some people, even within that methylfolate cycle, if you're not absorbing it, it's just, you're gonna have a side effect. Like I know you were sharing, you're wired.
So I haven't, I should add that. So I haven't been supplementing because every time I take methylfolate. Now I don't have MTHFR. I've checked.
Yeah.
So I have no problem converting it. But I can't take it without like really being almost hypomanic. It's crazy. And so I've just been like, wow, folate doesn't agree with me.
Yeah. I think it's likely an absorption issue. And it's hard to know where that's coming from. Now, in your case, in a lot of cases, sometimes, let me say this about the MTHFR people out there. I think most of them think if I just take a methylfolate supplement, that's like going to get my body to where it needs to be. I think even if you have the MTHFR variant, if your body's really healthy, your body can still create methylfolate. It's not that it can't, it's just not efficient as others. If your gut microbiome is really healthy, people are going to convert things very well. But if you're missing certain bacteria and enzymes within your microbiome, your absorption is just very low and you'll get the sort of symptoms you're talking about. So I really think for you, it's probably more of a microbiome issue and maybe a deficiency of a certain type of bacteria.
Interesting. Okay.
Or it could be overgrowth that's keeping a certain type of bacteria from creating an enzyme or helping your body in the conversion process.
Cool. That's cool.
Yeah.
It's not ideal.
Well, it's not cool. I mean, it's not cool for you, but yeah.
So you've done a lot of work on gut health, which is fascinating because I do think, we talked about this on the podcast I did with you, but I do think most of these problems come from the gut. There's just like things wrong with the gut. There's a lot. So where should people start, I guess, to start to look into gut health? Is like when you take a patient, is that where you start? Or do you run a whole slew of tests and then look at that, try and diagnose things from there? Take me through your process.
Yeah. So there's a few things I do, and it depends on how deep I'm going with somebody. So, if I'm actually seeing a patient, I look at their symptoms, and that's the first thing I look at. Okay, what all are you dealing with? And then one of the other things I do, the first things I do is I have them either if it's in person, which is rare, I'll have them show me a picture of their tongue, or if one of my practitioners, will get a picture of their tongue. And I also do a fair amount of Chinese medicine, and the amount I can tell from looking at somebody's tongue about their digestive system is a lot. So for instance, if somebody has ridges on the side of their tongue, that's in Chinese medicine, that's actually called a spleen qi deficiency, but really that means your digestive system is weak. Okay. So there's not enough cellular energy, mitochondrial health, like your digestion is weak. So there are specific herbs and foods and supplements that actually build up and strengthen the gut. So in that case, astragalus is very good for building and strengthening up the gut. I would put that person on a diet that's really a lot of like sweet potatoes and pumpkin and a lot of soups, beef, lamb, those sort of like things that you'd eat in the fall and Thanksgiving, like cinnamon and ginger. So that's going to really help that weak digestive system. Now, other people might have more of microbial overgrowth. Now, the one you're going to see most on the tongue is yeast. Okay, that's what you're going to see most commonly. And sometimes the coating is just thick on top. Sometimes it's actually embedded. That's where I know it's been there a long time.
Ew.
And there's a difference between if it's on the back or the full. If it's in the middle of the tongue, that means it's more in this. It's even in the spleen and the upper digestive system. If the coating is only on the back of the tongue, that means more of the microbial dysbiosis is going on in the colon. And so anyway, so I'll look at the tongue and there's a lot I can tell from that. And if that's the case, we want to do some natural antimicrobials. In certain cases, people can go and take, if it's very specific and we run blood work or do a stool analysis, Maybe they do get on a conventional antibiotic, but 99% of the time, or in most cases outside of the rare ones, we can do ozone therapy. We can do some natural antibiotics like oregano. We can do silver IVs, a number of those things that work. Caprylic acid, berberine. So there's a lot of those things. And then I tend to try and not rack up a big blood work bill for people early on. I really try and figure out, based on their symptoms, tongue diagnosis, and some other things, what's going on. And if we can fix it that way, let's do it that way. If not, then let's do some blood work or I tend to do a stool analysis and a mycotoxin test, also looking for parasites. Mm-hmm. And then when we do that, we also know a little bit more about, what's going on and how to treat that. Because an anti-parasite versus an antifungal versus an antibacterial versus an antiviral, they're different herbs and supplements somebody should be taking. So for parasites, it's things like black walnut and wormwood and garlic and those sort of things, which are going to be different than if you've got, it just depends on what you're dealing with. But so I tend to look at, tongue diagnosis, the symptoms, and a combination of different labs.
Okay, interesting. So when I was a kid, I used to get I'd get strep and a pneumonia all the time, like every year.
Yeah.
And for pneumonia, it was every year I was on immune suppressants. So I'd pick up a cold, it'd turn into a pneumonia. I'd go on antibiotics, then I'd go on antibiotics again, then I would get sicker. Then my mom would bring me to Linda, the Chinese doctor. And I'd be like, my mom is insane. And Linda would look at my tongue, and then she would do cupping to loosen like phlegm.
Yep.
And then she would give me this disgusting drink that we had to brew at home that was full of sticks, and it looked like it was horribly bitter. And then it would get rid of my pneumonia.
Yeah.
But every year we did the same thing. It was like antibiotics, eventually go see Linda out of desperation.
Man, we should have saw Linda first. See Linda first.
I know. We never saw Linda first. I don't know why we didn't see Linda first, but it was wild to me, even as a kid, be like, let me see your tongue. I'd be like, what is happening? Like, what's Linda doing? And it would fix the pneumonia. Yeah. And I ended up in the hospital in grade 6 from this pneumonia that wouldn't go away, probably because of the immune suppressants. But Linda's Chinese medicine, there was something there. I haven't done a lot of delving into that. So is the reason that you look at tongues in your patients, is that from Chinese medicine?
It is. Yeah, it's some of my training there. And again, there's a lot that you can tell looking at the body. Another thing you can do is feel someone's pulse, but somebody has to be trained.
Oh, she'd do that too.
Yeah. So somebody has to be trained in that. And, but yeah, again, there are people that are incredibly both intuitive and have learned to read the body in amazing ways. I mean, there are people that can look into your eye and look at what's going on in the different color of your eye and tell what your health problems are. There are people that can look at your tongue, your pulse. I'll tell you, so we've got a dear friend of ours who's a Chinese medicine doctor. And so Chelsea, I remember before we even knew she was pregnant, he went in to see her, and he kept going like this to her. He goes, "Chelsea, your pulse feels really good." And she's like, "Okay, what are you trying to say?" And she's like, "Well, you're pregnant." And Chelsea was like, "Well, I thought I could be, but I didn't." I mean, and so what you'll feel in a pulse of someone's pregnant is you'll almost feel 2 beats, like one on top of the other. Yeah.
Oh, that's cool.
Yeah. Yeah. It's pretty amazing.
So with Chinese medicine, if I went to China and saw a doctor, does that mean that they're doing Chinese medicine, or do they mostly do conventional as well?
No, well, they do more what we'd call Chinese medicine today. And generally in the healthiest countries in the world, or at least the healthiest country in the world today, I believe, is Japan. And they practice, I think it's called Kempo. And it's a type of what we'd call Chinese medicine today. We call it Chinese medicine. What they do in China today, it's called TCM, traditional Chinese medicine, and they primarily look at something called the 5 elements, and it's a way of grouping conditions together. So they will, like in Western medicine today, doctors look at things, and we have even different doctors based on different organ systems.
Yeah.
In Chinese medicine, rather than 12 or 15 different systems of the different organs, they look at systems of the body in 5 different systems, and they will treat you based on they treat you based off not of a condition, but off of an imbalance. So they'll look at your body and say, okay, your body internally is too hot or too cold, or it's too damp or too dry, or there's too much movement or not enough movement. In pneumonia, it tends to be not enough movement, which is what cupping helps move things. It tends to be too much dampness, which is why all the bitter herbs.
Moldy basement I was living in too.
Exactly. And mold is a type of dampness, as is candida or any type of microbial overgrowth. And it depends on the type of pneumonia. It could be too hot or too cold. But that's the way that they'll look at the body is they will, here's what they believe. Our entire medical system today is based off of some of the findings of Louis Pasteur, who developed pasteurization. And he developed the germ theory, and he said, it's germs that make you sick. Well, there's another physician, his name was Bechamp, who really goes back way before him in ancient Chinese and Ayurvedic medicine, that said, no, it's not germs that make you sick, it's your internal environment or your external environment, how that impacts your internal environment that makes you sick. So today, if most doctors, they're doing it all wrong. If you come in with an issue like SIBO or candida or something like that, they're just going to bomb you with antibiotics. Whereas the ancient medical doctor, they're going to look at your body and say, okay, the environment's off. What's going on here? Okay, let's do things to get rid of the dampness. Well, bitter foods get rid of the dampness. Hence, the most disgusting drink you've ever drank in your life was probably andrographis or some other bitter herb that helps drive all of that mucus and phlegm out of your lung. Because the thing about that's what pneumonia is. There's water a lot of times. There's fluid in your lungs. And so that's what they were doing, is changing your environment, because they believe your body heals itself. So do I.
Yeah.
We just need to change the environment. It's like, hey, you've got a river or a stream that's got all these toxins in it. Well, let's remove the toxins. Well, now the fish can thrive. It's the same kind of idea.
Wow, that's so different than conventional medicine.
Yeah.
It's crazy. But it really worked. And this worked multiple times on me when antibiotics didn't work and I was extremely sick.
Wow.
And immunosuppressed. And I had this bitter, horrible tea, and then it fixed me. I was just like, what? I'd rather take antibiotics than drink that. That was before I knew that it was much a better idea to just drink the tea. If you're the type of person who on occasion likes to partake in a few alcoholic beverages, but also you don't want to wreak havoc on your body and you're health conscious, you should have my hangover supplement After Party at your house, available at all times. It's made of dihydromycin, no fillers, just pure dihydromycin, which helps break down acetaldehyde, which is what ethanol, alcohol, converts into in your body, that poisons you, damages your organs, damages your brain when you drink. It's not the ethanol that feels fun that's the issue exactly, it's what it breaks down into that damages your brain and organs. If you could break down that poison faster, wouldn't you? I cannot explain over an ad how well this works. So if you do try it, you can get a 30-day money-back guarantee if you buy through fullerhealth.com. You can also buy it through Amazon, super fast shipping, but if you want the money-back guarantee through Amazon, you need to email us through the website to get it. So don't take my word for it. Read the reviews, try it, fullerhealth.com or After Party on Amazon. A couple of years ago, you had a back injury that was really bad.
Yeah.
So what happened? How did you get through that mentally? Because you've definitely been where I wouldn't necessarily call it like that's a low place to be.
Yeah.
So let's describe what happened a little bit and how you got through that.
Yeah. About 10 years ago, I hurt my back lifting weights, doing something stupid. And I herniated 2 discs on my back, and it was extremely painful. And I did everything I could imagine, from physical therapy to chiropractic to functional movement. And I got probably 50, 60% better, but not all the way. I mean, I dealt with chronic pain every day in my back. And then I got turned on to stem cell therapy. And I went and got stem cell therapy done. And all of a sudden I was like, wow, I'm now 75% better. I got it done one more time. And then I was like 95% better. And it moved the needle more than anything. And they took my own bone marrow, put my own stem cells back in my disc. And it was just amazing. And then I thought, okay, I'm 95%. And I was back squatting, deadlifting. I could do triathlons. Like, I was in great shape, but I still had this little bit of nagging pain in my back a few days a week. And I thought, okay, I'm going to get stem cell done one more time. And I bet I'll be back at 100%. Well, something went wrong when they did this injection this time. And I felt worse the day after, which was weird. And then worse and worse and worse. I went and got an MRI, and it said I have these things called modic changes, but there was no real major issue. And I thought, okay, I might have re-injured my back with these stem cells doing something. And then one morning I woke up and I couldn't walk. And the pain was so excruciating, it was unbelievable. And if anyone's ever had nerve pain or disc pain, it just does not go away. And we were in Puerto Rico at the time. We had to call an ambulance. They came and picked me up, put me on a gurney, brought me to get an MRI, and I got the MRI results back, and it said I had a spinal infection that was in my disc. It moved into my bone. It was in my entire L5 vertebra, and it was moved into there was an abscess, even in the spinal canal of the infection. I had to take a medical flight. Again, this is like out of a movie. I got in a gurney, put on a plane, flown to Florida, where I then met with an infectious disease specialist, and he said, Josh, I want to be straight with you. This is a really severe infection. It's throughout the bone. And he said, listen, this could kill you. He said, the best case scenario is you're going to have chronic pain the rest of your life. He said, a likely scenario is you're going to be permanently disabled, and we're going to have to go in and do surgery and stabilize this area with And so Mikhaila, I was a few months before, like throwing my 2-year-old daughter in the air in the pool, was in great shape, felt great. And then I had a doctor tell me, like, your life's never going to be the same. And I had 48 hours of feeling like my life was over. Really feeling like just the absolute bottom of I've ever felt. And I spent time just in prayer. And I felt like God, after about 48 hours, was like, you know what? Just fix your eyes on me, walk with me. And he didn't tell me I'm going to heal you. I just really feel like this sense of this presence of the Lord was like, walk with me. And I was kind of like, there's only a couple times in my life where I felt like that distinct, like the Lord just consciously impressing something upon me. And I was like, and by the way, I haven't really shared this on a podcast, but I kind of had this conversation with God of like, well, what does that mean? And after the first 24 hours, God was like, okay, listen, you're not walking with me. You're trying to like bear this burden by yourself. You're trying to carry this thing. I didn't say that. I said, walk with me. And so what I did is I kind of felt like God put me back almost in time, like consciously of like, and I pictured God walking through Adam with the Garden of Eden. I pictured him walking with Enoch and with Moses and with all the people in the Bible. And then even pictured my own life. And the word that just kept coming to mind was, I'm faithful. And so for me, that was the greatest encouragement of just knowing God was walking with me no matter what happened, and that I was going to be okay. And so I spent that time, and then it was like, okay, you know what? I'm going to get back to 100%. And God, I pray that you will help me get back to 100%. And the infectious disease specialist was recommending I get on antibiotics for 3 months, which, Mikhaila, I had not taken a real medication since I was in high school. And I'm 40. This was like over 20 years. So I was very conscious of like, I'm constantly helping people heal their gut, and I know how bad antibiotics are. So to have to be on them for 3 months, very strong and multiple antibiotics, I was incredibly concerned. I read a study on hyperbaric chambers and how those make antibiotics more effective and drive them deeper, and they can reduce antibiotic time. And so I put together a program for myself and worked with a couple other doctors on this, where I did get on a conventional antibiotic for 28 days, but I got in a hard shell hyperbaric chamber every day for 30 days and then quite a few days for the first 90. I did ozone, I did methylene blue, I did ginseng silver. I was doing everything, and did that for 4 weeks and killed the infection that way. And then my gut, I know was definitely a little bit hurt, but then I did 1 trillion probiotics a day, very high dose.
Wow.
Along with, again, a number of other things, high dose B vitamins, some other things. And I really feel like my gut healed completely, if not got better to where it was. And I didn't walk for 10 months. And then I was on a walker for 2 months. So I didn't walk on my own for a full year. One thing I didn't fully, now I knew this to a degree, but not to the degree when you experience it. The discs of our body have almost no blood supply. So they take about 3 to 5 times longer to heal than other areas of your body. So that's why it took me, even though I was doing all the right things, it took me a while to heal.
Okay.
But now I'd say I'm back 90%. I just went on a snow skiing trip to Park City. I'm going on another one. I can lift, I can carry my daughter. So I'm already way better than that doctor told me I would ever be. And I praise God for it and the power of natural medicine. And so I'm in, I'm incredibly grateful for where I'm at now. But, like you were sharing this when you came on my podcast, that we were talking about how I would never, we never want to go through those things, but God uses all things for good. And the amount I know now after experiencing that in terms of how to treat people and care for patients that have gut issues or different types of infections, I know so much more now than I did before. So and I've also been more committed now to learning about longevity medicine, healing the cells and mitochondria. So I have learned a lot from it. Yeah.
That's a crazy way to spend a year.
Yeah. And when I say I didn't walk, I mean, I couldn't even sit in a wheelchair. Like the only thing I could do after a few months is I could crawl and get in a pool, and being on with no weight, I could be upright.
That's crazy.
Yeah.
That happened so quickly too.
Yeah.
Oh my gosh.
Yeah.
Wow. Well, good for you.
Yeah.
Nice. You mentioned methylene blue, and did you say Jensen silver?
Yeah, it's a type of silver, like not colloidal, but it's a type of silver in it that you'd get in an IV.
Okay.
Yeah.
So does it work kind of like colloidal silver?
Yes. Mm-hmm.
Okay, and was that used for, what was that used for?
Naturally fighting the infection.
Okay.
Again, what I was trying to do was just limit my time I would need to be on conventional antibiotics. And it worked. It did help.
Great. Okay.
Yeah.
And then methylene blue. I've heard this thrown around a bunch. I've seen people with the blue tongues.
Yeah.
What does that do? That's scary. Is it a dye?
It is. So well, it's the color blue. So methylene blue has been used for, actually you can look historically for a really long time. It's been used to treat different types of infections in the body, sometimes urinary tract infections, actually.
Oh, okay.
Yeah, quite frequently. And actually there are studies now showing it actually helps healing and energizing our mitochondria. It actually helps your body create cellular energy. And there's a lot of patients with chronic infections, even like Lyme and different viral infections as well, parasites, that respond really, really well to methylene blue.
Interesting.
Mm-hmm.
Okay. So it's not a scam.
No, I do want to say this, because this tends to happen. Somebody will take a vitamin, a supplement, a treatment, a medication, and say, this is the cure for everything. And I think one of the things I learned most as I studied ancient forms of medicine was I don't believe in one diet for anybody. I believe in a personalized diet. Like I don't tell everybody they should be on a carnivore diet, but for you, it works exceptionally well. Your best friend might be the worst diet for them. Who knows? I mean, so I think that it really depends on actually your best friend is probably your husband. So it's, it works actually great for them. But my point there is that everyone should be on a personalized custom diet. And I think the same goes with your therapies. Like there are people out there saying they're recommending everybody take methylene blue. No, that's not right. Same thing. I saw this recently with ivermectin. I had people saying, well, I'm on ivermectin as a vitamin. No, that's an antiparasitic drug that if you have a very specific medical condition, absolutely take ivermectin. But don't be like giving it to your kids like it's a vitamin. It's not for that. Now, again, I think it's less strong than an ivermectin or certain other medications, but still, I don't think it's something that people should do as everybody should do.
Ah, okay. That makes sense. And then, no, I'll skip ivermectin. So you talked about IgG panel, micronutrients panel. So a micronutrients panel, what's the difference between a micronutrients panel and a vitamin panel you'd get at a conventional doctor?
Oh goodness. I actually, most conventional doctors I know, they don't run a nutrient panel outside of vitamin D. Trying to think.
What is a micronutrient then? What's the difference between that and like a B vitamin or?
Well, no, B vitamins are micronutrients. And so there probably are, now I would say the doctors that are running micronutrient panels are probably more integrative medical doctors or functional medicine doctors. And so they're probably the same test, I would imagine. I mean, an oat or an organic acids test, I think sometimes goes a little deeper and also looking at different like amino acids. It can tell a little bit more, but micronutrient panels, conventional medical doctors used to never run them. But since you have more and more people being educated like ourselves, probably going in there saying we want them, more of them are probably running them now.
Yeah. Okay. And do they give you a different view of a vitamin than like a regular blood test for a vitamin B? Like if you got vitamin B tested on a micronutrients test, does that give you a different outlook than a regular vitamin B test? Or is it basically the same numbers?
I think it's probably the same numbers. Let me say this though. A micronutrient test is typically a blood panel. An organic acids test is typically urine. And so they a lot of times they'll show the same thing, but sometimes they will be a little bit different in terms of actually showing what you're deficient in. Because like you can have nutrients in your blood and maybe they're not taken up in your cells. Where an organic acid sometimes might be more accurate in certain ways. It's showing maybe more what you're excreting, which sometimes shows you how well you're breaking things down or even absorbing nutrients. And so both those tests are used to typically to tell what nutrients you're deficient in.
Okay, cool. So let's go back to Chinese medicine a little bit. Are there like a couple of things that you've brought over from your knowledge of Chinese medicine other than looking at tongues that you use pretty frequently that wouldn't be something most people know about?
Yeah, well, I would say a lot. I mean, every diet I create for somebody is based more, it still is a combination of functional medicine and TCM, but my diets, what I recommend for people lean slightly TCM. And I mean, Mikhaila, I've treated like thousands of patients, if not over 10,000. And I have found in this, using Chinese medicine in terms of those dietary recommendations is the most effective thing I've seen for helping somebody heal. Because like when I was really early in my career, I'm talking about like my first year, I put people more on like, I was like, hey, gluten-free. So like I would work with kids in the autistic community. We'd go gluten-free, casein-free. And then I started saying, okay, well that helps, but still it's not doing as much as I want. And then I got turned on to the GAPS diet. And that was a really big step forward. And I found, okay, this GAPS diet is really great for a lot of people, especially with, gut microbiome issues, neurodegenerative issues, autoimmune issues. And then from there, I kind of moved forward into more of a Chinese medicine diet, which actually has a GAPS diet is really good for still a lot of people. But it sort of taught me to recommend certain foods for certain things. So I'll just to give you an example, like if I know somebody has a liver issue, I'm going to recommend they do a lot of steamed vegetables and a lot of foods rich in glycine like bone broth. And so they're just very specific foods for activating the liver. So foods that are green and sour tend to be best for detoxification, along with a little bitter. If somebody has a cardiovascular issue, the best thing they can do are bitter foods, bitter and red. Those really, so think about tomatoes or an herb like hawthorn or pomegranate, like very healing for the heart and cardiovascular system. If somebody has a digestive system, upper GI, that's going to be more orange foods. It's going to be sweet potato and pumpkin, and even beef would fall into both the heart and the upper digestion category. And then the immune system are foods that are white and light yellow. So think about this, like when somebody's sick with a cold or flu, it's like you give them chicken soup, which is yellow broth, or ginger herbal tea, which is yellow, or garlic or onion or miso. These are all yellow foods that activate the immune system. Pears in Chinese medicine are recommended for respiratory issues. And then let me just, and then the last one would be, and the immune issues are also tied to colon. And then the last one is hormonal issues. That you tend to recommend a lot of, or adrenal issues. That's a lot of mushrooms, which are multiple colors, a lot of purple and blue and black foods tend to be more nourishing for those. So based on the condition, I use kind of foods and flavors as sort of some of the medicinal ways of treating different conditions.
How did that culture figure out that different colored foods impact different organs?
Well,
it's so different. It's definitely different from what I've learned, but obviously it seems to work. And that Linda person definitely was able to cure things. So like, why does that work? Do they know why it works?
Yeah. So it's the very same reason how you found out that the lion diet works for you. and what doesn't work. Only what you've had is we've had thousands of physicians. Imagine thousands of physicians for 1,000 years.
Yeah.
Testing and trying and paying close attention to patients and working with them, doing millions of individual case studies and being able to dial in and figure out these patterns. I mean, one of the things that your dad talks about, I love that he talks about this, is like, well, how do you know what truth is? Or how do you know what the best decision is to make? One of the things I heard him say was, well, who are the top 5 investors in the world? Okay. Where do they overlap? And what's true of that they all say these are the financial principles that work, right? Same thing with maybe, so I think it's a very similar thing. As they started noticing these patterns between, oh, sour activates the liver. Oh, bitter activates bile release and clearing dampness. Oh, okay, well, all bitter foods must do that to a degree. Well, what's the most bitter? What's the least? Okay, what happens when you have something that's bitter and sweet? Oh, well, it's going to have this impact. So they were just
Interesting.
Yeah.
So it's got to be compounds in the bitter taste that seem to activate certain parts of the body or something?
Yeah, exactly. Yeah. So we know that sour does something, like every probiotic food ever is sour.
Yeah.
I mean, and so that's very directly effective to creating a certain environment for microbes will grow. Now, in somebody with SIBO or certain types of histamine reactions, anyways, that's a whole different topic.
You don't want that, I can't do probiotics. It's got to be something like SIBO. I thought this for years. It was like, why can't I can't tolerate any probiotics? Like, it's got to be something like that.
Yeah.
Cool.
Yeah.
Wow.
Well, let me say that there is a type of probiotic that's less prone to being sour. And they're called soil-based organisms. They're known as spore-forming bacteria. And so people, not always, but people with SIBO or microbial issues that have histamine reactions, they tend to do better than with the soil-based organisms like Bacillus subtilis than they do the food-based probiotics, because the soil-based tend to have less of an affinity towards sour. Part of the sourness helps them survive and grow, versus the soil-based organisms don't really need that. And the soil-based organisms are transient. I mean, they just pass through your system. Some of the food-based will have more of an impact on hosting and living in your system.
Interesting. So that's like Spore Biotics?
Yeah.
That company? Okay. Mm-hmm. Cool.
Well, it's not there is probably a company, but it's just a type. It's a type of probiotic.
Spore Biotics is a type.
That a few companies will include in their products.
Interesting. So, okay, let's talk SIBO for a bit, because I feel like there are quite a few. I'm pretty sure that's one of my problems. I know that my mom just did a SIBO treatment and fixed her like crazy things have been happening with her. Like the lion diet put her arthritis into remission. She was doing well, but her digestion was never good. We're like, well, something's still going on with gut. And she's done this protocol. And one of the treatments that helped was SIBO treatment. Mm-hmm. What do you do? It's more the natural route for SIBO.
Yeah, so for SIBO, and this is where the way that I treat patients, I try and be incredibly holistic in terms of also looking at the mental and spiritual aspect of the person. And so what I found in SIBO patients, and this goes back to Chinese medicine, is there is a component of stress that is very highly related to SIBO in most people. This isn't across the board, but I would say it's the sort of person who is, you're on all the time. You just never switch it off. And that could be even doing good things, but it's just like constantly like, moving forward. And so I think in SIBO, that exacerbates SIBO, is that not turning it off. And so like, for instance, one of my biggest recommendations is when you eat, don't look at a screen, don't have anything. I want you to take 30, 40 an hour to eat your meal. Like I want you to sit there and chew.
I've had multiple podcast guests. They're like, how long do you chew? Yeah. It's like not very long.
Oh yeah, it's big for SIBO. Taking deep breaths, seeing what's going outside, having a conversation but it's like slowly eating, chewing, and creating a lot more of those enzymes via your saliva. That is one really, really big thing that helps. Licorice root extract before meals. You can do DGL. That is one of the ancient recommendations in TCM for helping with SIBO over time. And then, we're in a world today that's just, let me say the other thing would be simple, smaller meals. Eating big meals is hard on the digestive system. Doing astragalus tends to be good, but doing they would tend to recommend a white rice, like a jasmine or basmati, with something like fish, like just something that moves through your system more quickly. would tend to be recommended too, or that's what I would recommend for somebody with SIBO. And then there are going to be other things. I would recommend a soil-based organism probiotic, none of the, I wouldn't recommend any of the more food-based, like the bifidobacterium or the lactobacillus species, more of that soil-based. And then in certain cases, then we need to look at clearing out a lot like H. pylori and bad organisms that maybe have just taken over. And in that case, I like to start off as natural as possible. I mean, listen, if I have a patient, and this is so rare, but if I do have somebody that's an extremely hard case, I may then work with an integrative practitioner, and maybe they would get on something conventional, like an antibiotic for a period of time, who can dial in the right thing, like we talked about earlier with what you've talked about. But I think generally, I try and do like caprosolic acid, grapeseed extract, ozone, via like an EBU or a 10-pass. I tend to do more of those types of things. And then I try and get higher and higher doses of the soil-based organisms. And yeah, I found when we kind of work on reducing stress, eating more slowly, taking more walks after your meals, very specific diet that's going to move through the system more quickly, that's worked in a lot of cases.
That makes sense. When I first started looking into this, like I looked at, this was right when I first went carnivore. So this was 2017. And I was like, it's got to be Candida and SIBO or something. Like that's got to be what's going on. And I was looking at protocols because I was very averse to the idea of antibiotics because I thought they caused a bunch of my problems. And I actually looked at the research behind herbal protocols in treating Candida and SIBO. And what the research showed from what I read is there are herbal supplements you can take that are at least equally as effective as antibiotics that like wipe them out. Yeah. So I used to have this view of treating things with herbs as like the less strong version, but that's not what the literature I read says. It's just more natural version.
I think the idea there is that maybe there's going to be a greater level of sparing of the good guys. I think is and now listen, I don't know that the research proves that. I don't have a study that proves that, but I think that is let me just say this. I think theoretically that's true when you're comparing a medication to an herb. I think that it tends to be, listen, I can say this from a food standpoint. If you're eating a blueberry, your body's going to react different to it, even if it's the exact same amount of sugar as high fructose corn syrup, even if they're both 30 grams of sugar. So that's the way that I view it. I believe that there is something that's easier on the body in taking an herb than a medication. But I also do believe there's a time and place. Listen, I got on a conventional one myself when I had the spine infection. Now I did everything I could to do the least amount possible, but I believe that's, it helped save my life. So.
Wow.
Yeah, there's a time and place.
That is very interesting. Where do you see, have you done any delving into like how AI is going to be able to, like, I guess, take all the data we have on health and identify patterns we haven't identified? Do you think we're headed in that direction? Do you think it's going to be good? Or do you think it's going to be trained on conventional systems and then it'll just be spitting out conventional medicine?
Well, we are going to have that. For sure. And that's going to be part of the battle. I mean, listen, there's a battle over information and then recommendations. Yeah. And so Google, listen, my website in the past, drax.com, we at one point were at 20 million unique visitors a month, and it was the #1 natural health website. Yeah. Google made an update in 2018 or 19. It was called the Medic Update. And we lost 80% of our traffic overnight. And the reason is Google had bought 2 pharmaceutical companies, and they wanted to, if somebody was asking about they wanted to push people towards medical sites.
Google owns pharmaceutical companies?
Oh, yeah.
Oh, I hate knowing that.
Oh, yeah.
I mean, I'm glad I know it, but that's not good.
They're essentially a biotech medical company. Yeah. Multiple. I mean, large. Yeah. So they, so all that being said, think about BARD or think about what Google's going to do. They want those recommendations to be more medical. And so when you are using that as a medical tool, it absolutely was going to push you towards more conventional. Now, I do believe there are people out there that listen, there's going to be a lot of AI tools, a lot. So I think eventually you will be able to, well, I think 2 things are going to happen. One, if you want to go see a doctor in person, let's say you want to get an acupuncture treatment, that acupuncturist will be able to lay you on a table, and AI is going to be able to read what's going on, and it will tell you exactly where to put the needles. I think eventually, like I'm wearing an Oura ring right now, I think you'll eventually be able to wear something like an Oura ring, or, you know, I don't know if you've worn like a continuous blood glucose monitor. I mean, that's picking up your insulin, and that's picking up your blood glucose. It's picking up something in your blood. Eventually, on your phone, it's going to tell you in real time what nutrients in your blood. It's going to tell you you should eat spinach and beef right now. Like, it's going to tell you the like, I think,
cool.
Yeah, you're going to have a whole panel of almost everything you could be deficient in. I'm trying to think right now how they're going to do this with stool and your gut microbiome, but maybe, I mean, this is crazy. I just thought this, but maybe when you use the restroom, it takes your urine and fecal samples, and your toilet, there's a panel, and it tells you in real time what's going on.
I mean, someone needs to build that.
Yeah.
I would use that. That seems incredibly helpful.
Well, we're eventually
that'll happen. That's got to happen.
We're eventually going to be there. Let me say this. I use AI now a lot myself in terms of like one of the things I've learned a lot from it, because I'll start to do research, and I'll say something like, okay, give me the top herbs. Like for instance, I've got a patient right now who's dealing with SIBO and stage 3 breast cancer and Hashimoto's. Okay. And then I will ask it, okay, and they have these patterns based on a tongue diagnosis. Okay, what are the top Ayurvedic? What are the top Chinese medicine? What are the top Western functional herbs and compounds that would be most effective in treating this patient? Give me those in ranking order. Okay. Give me a meal plan. Okay. And then I will work with AI on creating a supplement and food and even lifestyle plan. Because here's another thing too. Like, I really try and help my patients with emotional issues. So in Chinese medicine, if somebody has an autoimmune issue or something that affects the lungs and colon, they tend to, according to Chinese medicine, have something that's happened in the past they have not fully been able to let go of. And so some of the recommendations are Qigong, like deep breathing, spending time a lot writing about what you're doing, and then like throwing it in a fire and burning it, going and dealing with whatever the trauma was, forgiving the person and letting it go. And so that, and then there are other things too, like there's also fear, there's different emotions. But the other thing is I'll use AI in creating lifestyle recommendations and plans based on Chinese medicine and a lot hey, and then I'll ask it sometimes too, hey, what are the top Bible verses that somebody should meditate on that can help them overcoming this issue? So I use it already a lot, but in terms of it being able to read what's going on in our body in real time, 20 years from now, I think we'll be there.
That's so cool. I've been using Grok more and more. I was using ChatGPT quite a bit, and then Elon put out Grok, and I was like, okay, I'll see the differences between these two. It's incredible though. Like, I really relied on Google when I was first delving into what was wrong with me, researching what my drugs did, what cells they worked on, and reading study after study after study about like I said, medications or genes that I ran. Like, I really use Google. Grok, it's just like, it cuts days of research out into minutes.
Yeah.
It's insane. So I'm using that basically as a search engine. Basically.
Yeah.
I can't believe what the future is going to hold with AI.
Yeah.
Because it's unbelievable how much data they have access to. It's like having the best research assistant in the world instantly give you what you want.
Yeah.
It's so weird.
Yeah. But to your point, I think all of them are going to be incredibly strong at diagnosing.
Yeah.
But the recommendations they're going to have, I think, are going to be vastly different, to your point.
Yeah.
Yeah.
That would be my concern.
Yeah.
Is like, what's AI's, like diagnosing diabetes is easy, but then what does it tell you to do?
Yeah. Yeah, exactly. Hey, get on Metformin the rest of your life.
Yeah. Well, I guess we'll lose. Luckily, we have social media and podcasting and things. Right. And so we still have information going out there. That's amazing. Okay. Another question. What's the most, we went into like tongue reading. I feel like that's pretty unconventional, at least here, but I don't know if you call it tongue reading either. What do you call it? Tongue mapping? Yeah, it's tongue map. You got tongue mapping, face mapping. Yeah. Oh, that's so cool. But, what's the most unconventional health practice or experiment you've personally tried?
Oh, goodness. Unconventional.
I mean, we got into stem cells a bit. Those are, people at least kind of know about stem cells now. Has there been, we got into methylene blue. That's a bit out there.
I mean, let me say this. I do think my cocktail, like I was very conscious of like, yeah. When I was doing methylene blue, my pee was blue for a month. I mean, it was literally blue. It was, at first I'm like, why is my pee blue? I'm like, oh, okay. Yeah, I was doing methylene blue. I was just like, this is kind of crazy. Unconventional. Let me throw this out there because maybe this is so I'll give you a couple things. One would be just prayer and being still with God. I don't think that's probably very conventional. I kind of like to combine, there's this study on Japanese forest bathing, and that if you just go outside and sit in nature, it's incredibly healing. So I think for me, I think that one of the things that I've found to be incredibly healing for myself is I found if I have a certain level of stress or anxiety or something health-wise I'm battling, if I start to just get outside in nature and spend time trying to be in a state of awe and wonder, it's incredibly healing. I think that is maybe if I try and position myself in a state of, wow, look at that leaf. Wow, look at the sky. Look at the sunset. Look at the ocean. Just listen to the sound, and connect with God in that way. There is something so spiritually healing about that. And it's so different than what we are currently going through today. It's like most of the time it's like cell phone buzzy, an email reading, artificial light, in a box, where walls are closing in around me, just noise. And then to be able to get out in nature and then connect with God and spend time in gratitude and awe and wonder, that maybe is the most unconventional and definitely I think maybe the most healing thing that I've experienced. And I think, I think there's a lot of people that they're just so busy that their body can't heal.
Yeah,
I think busyness is maybe the biggest roadblock to people healing a lot of conditions today. And I think we need more margin in our lives to be able to just go out by ourselves. I mean, this is something we see Jesus do in the Bible. Jesus is like, what is he doing in the morning? He's going off by himself to pray in nature with God, to do that thing. And I think that if people could create time in their week to go and do that, I think that's as healing as a hyperbaric session, as an infrared sauna session, as an IV. So I would say that. And then outside of that, it's probably, doing an IV that had ozone, methylene blue, silver, Myers cocktail, and 10 other things in it, but that's, yeah.
Okay. I'm glad you brought that up. Actually, I was having a conversation with Mom yesterday about how differences between how I grew up and dealt with traumatic experiences and then what changed since I became a Christian.
Yeah.
And what changed for her. We were talking about this. And one of the things, I went through a number of therapists because when you have an autoimmune disorder and you're depressed and you're on psych meds as a kid,
sure.
they give you a therapist. That did not go well. I didn't have good experiences with a number of therapists. I eventually found one that was helpful. But then I met my husband and he was like, maybe you should stop delving into all these traumatic experiences. And he came from a, what I think is more of a Christian perspective was like, you're new, the past is the past, don't look back kind of thing. And that was actually unbelievably helpful for me because I grew up, and this was partly influenced by my dad who said, if you have a traumatic experience that you keep reliving in your head, write it down. And you talked about this with Chinese medicine is write it down, but throw it in the fire. Mm-hmm. But I think what worked better for me actually was rather than writing it down, because then I get into the details and I can remember a lot, especially from traumatic experiences that are hyper visual, is when my brain starts to go in that direction is going, that isn't helpful. And that's not forward thinking and focus on the good. Mm-hmm. And I used to think about that as avoidance and that there was something I needed to figure out, especially if something malevolent happened in the past. And I was like, why did that happen? I need to understand it. Things. But then it's the spiral you get into. And I was like, I actually am more of a calm person when I start thinking about something bad that I can't really solve. It's like something bad that happened to me, and just stop thinking about it instead of delving into it. So what's your, like, do you have a view of that? Is ruminating on it and trying to figure out, writing it down and doing therapy about these experiences that we all have that are terrible? Or like, what have you used for bad experiences?
Yeah. Let me share. So one, I would say that we live in a culture of rumination, and there are people today that are just focusing on the problems. And I think probably 80%, it'd be interesting what percentage your dad gives on this, but I mean, there's probably 80% of counseling sessions that are someone's going nowhere or sending them backwards. Because I truly believe in most cases, if it's not being done from a Judeo-Christian perspective, it's not leading people in the right direction. I think that there's a large group of people that you don't need to keep focusing on your problems. You just need to move past, as you share, this was a solution for you. Just focus on Jesus, move forward and past it. I do think that there's a group of people, and what I was saying wasn't doing it multiple times, it was once. It was because there are people that have they've buried things so deep down, and it's affecting them subconsciously, and they don't know it. So I think my thought there is that, and I've done this in different Christian circles. I did something called the Bondage Breaker years ago. I did something called Heart Sync. I've done a number of things. Like I'll just share. I went to a counseling session about 6 weeks ago because, and this is the first time in a long time. Actually, it's the first time I'd ever been to a one-on-one counselor, and I went because I had this full year of not walking and just that was very hard.
Yeah.
And then I had my best friend, my father-in-law, who was living with us. This was Chelsea's dad. He was 60, no health problems. I was going to the gym with him every day. He had a massive heart attack last year and died.
Oh my gosh.
And it was hard because like our whole entire life was wrapped up with theirs. Like he was like taking care of our daughter every day. Like that was very hard. And then I just felt like I lost a business. There were a number of things, and we lost both our dogs. Like all of this happened in like a very short period of time. And I'd never experienced that much loss all at the same time. And so I went and I basically shared with this amazing man. I said, one of the things he helped me realize is that I was kind of saying to myself, I was minimizing everything. And I didn't realize I'd just done this with everything.
Yeah, I get that.
I'm like, well, it's okay. I can just move on. I can move on. And he helped me realize, he said, no, listen, like you can't skip the mourning process. Like Jesus wept. Like you need to go and just take a moment and just cry about this and release and let go and, ask God to help heal your heart and not minimize things, because that's not, he's like, you don't want to be the person that's also over complaining and being a dramatic everybody, but he's like, there's real loss here. And so for me, I think I even went back and looked at my childhood, and it's like, because I have an old military dad who is like an amazing dad, but he's like with everything rubbed dirt on it, And so I think for myself, that was a healing and really beneficial experience. So I do think there's a group of people where, listen, you need to go one time with somebody, do something, pull the stuff up, and then give it to Jesus and say, God, I recognize I had this trauma. I forgive the person. I'm moving on. But if somebody hurts you and you're holding a level of resentment in your heart, I believe there is power in audibly going and doing and saying, I forgive that person. I'm moving on. But listen, I agree with you. I think in most cases, I think if the person's aware of it, wallowing in it is the single worst thing you can do. Mm-hmm. You're keeping yourself stuck. You're making yourself worse. So I absolutely agree with your husband, Jordan, and sharing that, because you were probably in the position where you talked about it enough. You've done it enough, so.
I like that. Sense. Yeah. I like that. That seems reasonable, because that was more the position I was in. It's like, I've delved deep enough into this. It's just is shitty.
Yeah. Totally.
That's just it. But like, it was up there though. It wasn't subconscious level.
Yeah. And I think like if I'm looking at biblically, I think it's very much in line with what your husband Jordan was sharing though too. It's like The Bible tells us to fix our eyes on Jesus. He'll help us overcome fear. He'll help us overcome worry and anxiety and depression and all those things. Like meditate on him and his word and be deeply connected there. And so I think there's a lot of wisdom there.
Cool. Okay. That was helpful.
Yeah.
Wow. Where can people find you?
Yeah.
I know you have a massive YouTube channel. You've been on the health scene. Like you were one of the first people I'd heard of, I think, when I started trying to figure out what I was doing when I first started healing, when I was like, I'm cutting out all my foods, and then people be like, oh, that kind of sounds like the paleo diet. I was like, oh, what does that mean?
Yeah.
Like, and then there turns out there's like groups of people talking about this that I'd never heard of, but you were one of the first. You and, who's the Apple guy? Mark's Daily Apple?
Oh yeah, Mark Sisson.
Yeah, Mark Sisson.
Yeah.
He was like back in the day too.
Yeah. Oh yeah.
Super early on.
Yeah.
But like, what are your channels? You have a podcast. I was just on that.
Yeah.
Where can people go?
Yeah, people should check out the podcast. It's the Dr. Josh Axe Show, and you were on there, so everybody should watch the amazing episode that you did on there. My handles are just at Dr. Josh Axe. I'm really active on Instagram and YouTube. So YouTube channel and Instagram where I'm most active. And people can search, like, let's say, for instance, if somebody is dealing with autoimmune disease or estrogen dominance or SIBO, they could look up Dr. Josh Axe hypothyroidism on YouTube, and you'll find a lot of content I've created on there. And then I have a virtual practice. And so people can check out the Health Institute there and learn more. And I have like a video training on like how to get to the root cause of your issue, and people go check out there, but those are probably the best places.
Perfect. Okay. I'm going to link all those in the description so people will be able to click on them. But thank you so much for coming out here and for helping me out over the last couple of years with the mold issue and all the health issues and being in touch.
Well, thanks so much for having me. I love what you're doing in the world too. Just, spreading good. So thanks for having me.